Okay. It is coronavirus day 425. It's stay at home day 33. And I bring some good news and some bad news, and of course I want to talk and of also some complaints. So today we have 2073 high cases. Okay, so it's really dropped. Okay. So today's cases are from 685 is high cases are from Toronto. 389 is from Peel Region, 2831 is from York Region, and 144 is from Durham Region. All other regions are reported under 100 cases, and 15 deaths have been reported. Okay. Of course, the variant cases UK variants is at almost at troubling. This troubling at 95,546 cases. So which is pretty alarming, actually. Yeah. And an increase of 2,283, and it's almost reached 100,000, which is just absolutely bad news. Start ringing the alarm bells. So 530 South African variants, which is an increase of plus 19. And 1,592, and the Brazilian variant is from 30, is an increase of plus 34, and of course the India double-mutant variant has not been updated yet because of course it is not a variant of concern as labeled by WHO and Health Canada. So, although I do wish they could just call it just it's a variant. It's a variant. It should be considered like that. Not to mention, Ottawa has been affected the most in Ontario with 141, Brampton with 36. If you add that up, it's 177. You do the math. And of course, they have India accounts for the almost 50% of all worldwide coronavirus cases worldwide, and also with 300,000 cases or higher per day, daily. Cremations and body burnings were involved. Of course, we're being good neighbors to India by with Doug's board sending a request for sending us some ventilators over to India. So which of course some people many Ontarians are still bad mouthing Doug Ford and said, well, open the province. Well, we can't do that right now if people are going to be breaking the rules, you know. Which I'm going to get to eventually, so I'll talk about it. And of course, Doug Ford and Brampton Mayor Patrick Brown have requested a stricter flight measures out, which is actually is like something that is should be done, and because we might never cut off like the direct flights from India and Pakistan, but connecting flights, so they could be going through airports from India or Pakistan into airports in Incheon Airport in South Korea, Beijing Airport in China, Tokyo Airport in Japan, or they could be going through USA to reach a certain destination in Canada. Like they could be going through LAX in LA, Chicago O'Hare in Chicago, JFK Airport in New York. I don't know if we've banned the USA has banned flights from there too, but I haven't seen that, but who knows? So my first order of so just before I talk about the topic one, which might anger people, a lot of us, including me, is so we can't really reopen the country sooner until we are like vaccinated everybody, guaranteed that we have like under 1,000 cases, like under 1,000, not 2,000, under 1,000, like we're in the hundreds. Like, and then not to mention the common cold, the flu, and of course a possible wave 4 of coronavirus could be showing up in the fall. So we gotta think about that first, like plan ahead, you know. Okay, topic one. So the Ontario government is looking to extend province-wide stay-at-home order into June. So originally it's supposed to stop until like the last day is May 19th. But they're planning on looking to extend it to June 2nd. So they first did it, you know, stay at home. Did that from April 8th to curb the coronavirus cases for the wave 3, and of course to trying to curb the case numbers and also hospitalizations. The only reason why it didn't work was some people having gatherings, breaking the rules. You can blame Toronto for that. Also, like people having gatherings, you know, for Easter, and they were misusing St. Patrick's Day, I believe. I'm like, come on, like St. Patrick's Day is like for like St. Patrick, that art. I don't know much about like Irish culture, but yeah, but it's not a drinking holiday. People just made it like turned it into a drinking holiday, like they turned Valentine's Day and yeah, into buy chocolate hearts and stuff. So they're planning on extending it to around June 2nd. Yeah, start cussing at me. Because whenever I talk about like this, oh, it's going to be extended, I tell that, and they're literally at least like one or two people are like disliking me because, oh, it's not my fault. Not me who changed the rules. And there's the reason why why the government had to change the rules, and it, you know. So, Health Minister Christine Elliott said, looking at like the current coronavirus cases, cases are sort of decreasing right now. So that is sort of in the good news. But the ICU cases are still high, and they're trying to make sure the ICU case numbers are lower before they can change the stay-at-home order. So it's the rules are pretty standard. You know, will still be the same. Stores providing essential goods, but they can only sell like, you know, essential items like grocery and pharmacy items. So non-essential retailers are limited to curbside pickup and also delivery. I think people always forget like people who are like non-essential retailers. It's not just curbside pickup. They can also like. I know a business who that's non-essential. Yeah, she did like e-cigarette business, but yeah, she does delivery too. So restaurants and gyms are of course closed, and of course restaurants and will have to resort to takeout, drive-through, and delivery. So playgrounds are still open. As long as people wear a mask, stay 2 meters away from each other, which some people still don't understand. And no wonder Peterborough police had to respond like at least 4 times. with people not following the rules, and also Coburg not following the rules. So hopefully we can get lower cases sooner, and we will not have to worry about anything. And if people actually do avoid having large gatherings and keep it on like a small number, we will not have a summer that will be canceled. Now my focus goes over to Hamilton. So apparently it's a coronavirus outbreak for Hamilton. So it's more than 100 cases at some apartment building in Hamilton, and 50 more cases that were detected at another two buildings, and so May 4th, the coronavirus cases were detected at a building at 235 Rebecca Street and Wilson and Wellington Streets area of Hamilton, and it increased from 55 to 103. The cause of the case is the UK variant. And one person tied to the outbreak has died, unfortunately. So Hamilton Mayor Fred Eisenberger, so paramedics said paramedics are going to door in a 164 unit apartment building over the past 2 days, offering a PCR approved coronavirus test to residents to make sure no one gets affected. So Mayor Fred Eisenberger thought that the local health, the Hamilton Public Health Unit, did everything in order to curb the spread of the virus, but there's some issue. There's something that people not wearing their mask or social distancing and elevators. That was to blame. And Hamilton Public Health Unit said last week that there was some close contact between apartment residents and socializing between individuals from different households and units was likely to blame for the spread. So the other two places was the Village apartment and 151 Queen Street North, and the Wellington Place apartments at 125 Wellington Street North. So the outbreaks are confirmed on Monday, and so far include a combined total of 51 UK variants. So other public health units have already have documented building outbreaks in North Bay. Yep, heard of that one. Ottawa. And Mississauga, that one happened. That was the UK variant. While the North Bay one, that was the South African variant. So there's been some information sent from Spain, South Korea, Hong Kong, and Japan that were just where they have found out that regular apartment ventilation shafts or ducts, even if they're working properly, can contribute to spread of aerosolized virus particles between units, unbeknownst to the residents inside. So this is basically a high risk to basically the people inside that apartment unit. So if the virus particles it goes through the ventilation shafts and ducts, if it affects one, it's going to affect the next one, and it's going to affect the entire floor, entire unit, entire apartment. And of course, I know that, because a lot of South Korea, Hong Kong, and Japan, there's a lot of high-rises, condominiums, and apartments. People live in a lot of those, especially if you're in the big cities. And of course, that is something that is actually common. And when I was in South Korea one time, down in the south, near the south, and also in Suncheon, and also in Seoul, South Korea. Yes, I've been to one of my aunt's places. My younger aunt from my dad's side of the family. Yep, I've been to her place. She also lives in an apartment. I've seen stuff like that. And also Suncheon, where the younger aunt, they also live in an apartment building, and it's sort of ventilation. It's all the same for all the ventilation, for all apartments and condominiums. So of course, if you want, vaccination, the details are down below. If you're going over the border, like the provincial border to Quebec, please follow Quebec border rules too. They're picky too. So, just a reminder to anyone who would if you were having a gathering of any kind, please do not have any gatherings anyway. Don't do it. So, you can be charged under the emergency management civil provincial act. So you can get charged $750 each, and sometimes an additional $130 surcharge, which will total up to $880. So this is, sometimes you might get charged extra. Most of the time you won't. If you get stopped through a ride check, which is completely legal. Timmins police had to do one of these, and they caught 5 people from Brampton, Brantford, from 5 different addresses. And they were not going together for essential reasons. So they got fined $880 each. So that's the fine for if you get stopped at a ride checkpoint. So $1,000 for trying to prevent others from actually following coronavirus regulations. So if you're doing something illegal and trying to prevent people from actually following regulations, yeah, you're a bad person. You're a bad person if you do that. And $10,000 for those who organized or planned the gathering. And I've been told by the government. So if it's like people take it way too extreme, you could get a fine, a maximum fine, which is like at least 1 million, at least, and jail time is added. So of course I'm gonna talk about coronavirus hospitalizations, which unfortunately is at 1,782 people hospitalized. So this is bad news for the critical care nurses. It's a plus 150, 802 ICU patients, minus 226, with 568 of ICU patients using a ventilator, plus 21. Long-term care home deaths is at 3,764. Again, back up. Staff deaths are still at 11. Have not changed. And 46 outbreaks, so it's back to that's a plus 1 if you actually compare it from yesterday. So please follow coronavirus safety rules and regulations, and stay-at-home rules. Don't have any gatherings of any kind. Follow Ontario and Quebec border rules if you're crossing for essential reasons. Ontario-Manitoba border or Ontario-Quebec border, and Quebec has their own border rules too. So people who are acting too selfless of themselves and act like their rights are like this. Okay. It's not always about your rights. If you really want this coronavirus thing gone, you can't just act like a complete stuck up and trying to trying to break these rules and because that ain't going to work. So that's going to literally increase coronavirus cases again, increase hospitalizations again, which I feel the sympathy for. I feel bad for the critical care nurses. And the chances of us having wave 4 of coronavirus in the fall will definitely be guaranteed if you still act like a stuck up, and be smart, follow the rules. Don't, because maybe someone you care about gets coronavirus because of your foolish decisions, or maybe a loved one, or maybe a friend. Think about it that way. Stay safe.